Thank you, everyone. We're ready to get started.
Marion, we ready?
Yes, please.
Okay, well, welcome everyone, and thank you for your patience. And thank you for joining our webinar today entitled, How Communities Can Use CDBG Funds to Address COVID-19. My name is Priscilla Almodovar. I'm the Chief Executive Officer of Enterprise Community Partners. I'm so pleased that we have such an excellent group today assembled here for this webinar. We have 1,400 people registered. We have representatives from state and local governments, nonprofits, academia, small business, philanthropy, and more. For any of you who are not familiar with Enterprise, Enterprise works to improve communities and people's lives through affordable homes that are connected to opportunity. We work nationwide. We provide capital, programmatic support, and policy solutions for low-income communities. We're also an owner and operator of housing that is affordable to more than 13,000 households in the Mid-Atlantic region. Over the past 7 weeks, I suppose for all of you, as for Enterprise, our work has taken on a new intensity. We all know the facts. We read the papers each morning, but let me just call some out because they're quite staggering. One, we have lost well over 50,000 lives to COVID-19. And there are more than 920,000 confirmed cases. And we also know the disturbing fact that this public health crisis is having a greater impact on people of color. Two, between March 1st and April 23rd, nearly 27 million Americans have filed for unemployment benefits. Three, while the CARES Act offers temporary eviction moratoria to some renters, at Enterprise, we are very concerned that a potential wave of eviction could happen if the government does not offer rental assistance before the moratoria expires. Four, landlords are also facing distress with loss of rental income and a significant increase in operating expenses as they keep their buildings safe while their residents self-quarantine. Plus, landlords who do not benefit from the CARES Act temporary foreclosure forbearance are still required to pay their monthly mortgage payments regardless of whether their tenants are able to pay rent. Five, COVID-19 is slowing down new rental construction. Developers are facing cost overruns due to delayed timetables and disruptions in supply chains. Six, there's a concern about the liquidity pressure on mortgage servicers as they are required to advance principal and interest payments on their mortgage-backed securities, even if the underlying mortgages are not paid. And lastly, and this one is gaining greater urgency with each day, state and local governments are facing and will continue to face significant budgetary constraints due to tax revenue losses, but also increased demands for emergency measures and competing different interests that they'll have to address. To address all of this extraordinary financial impact on people's lives and our states, on our local governments, the White House and Congress work together to provide nearly $2.8 trillion in assistance. And that is what brings us here today. Over the next hour, we're going to talk about HUD's Community Development Block Grant Funds, known as CDBG, to address COVID-19 in local communities, including the $5 billion in new CDBG funds appropriated under the CARES Act. I'm honored that we are joined by HUD's Acting Secretary for Community Planning and Development, John Gibbs, and the CDBG Office Director, Jesse Hanforth-Combe, who will share the latest on HUD's efforts to speed funds to communities, and they are also available to answer questions. Before we turn it over to the HUD team, Patrick Jordan, Vice President for Enterprise Advisors, will address how COVID-19 is impacting communities and will give a quick overview of the CARES Act. Then Patrick will turn it over to our Senior Vice President for Public Policy, Marion McFadden, who is also an expert on CDBG, and she will introduce Acting Secretary Gibbs and his team and will moderate a Q&A. Finally, Marion will close with some thoughts on advocacy for future federal aid. If you have any questions, please type them in the Q&A box at any time. And again, everyone at Enterprise thanks you for joining us today for this webinar. Patrick, it's all yours.
Thank you, Priscilla. As Priscilla mentioned, the impact on communities of color, on our most vulnerable residents, on children, on seniors has been immense within the context of the impact on COVID-19. Over the past 5 weeks, we've seen unprecedented unemployment claims. If we could advance to the next slide. The needs for state and local budget, the concerns around state and local budget are overwhelming. We're hearing that consistently across the states and the communities in which we work. And in addition to that, we've done some outreach with about 100 of the 800 communities that we've worked in the last decade. And we're hearing some themes, both on how communities are dealing with lots of challenges around which employees are considered essential and the amount of work that they're having to do at a time where other employees have been furloughed. And even within that space, communities are already starting to look at long-term recovery and think about how they can leverage the work they're doing right now to address some of the challenges that they're otherwise going to face in a month or 6 months or in a year. So if we can move on to the next slide. In addition to HUD funding, there were several allocations for non-housing to support small business, to support individuals, to support general disaster recovery through FEMA. And there are a couple of reasons why we need communities to be aware of this resource, of all these resources, both because this is another way in which residents can get help, but also because as you're thinking through how HUD resources will be used, particularly CDBG, these need to be at least things you're aware of from a duplication of benefits perspective, so that you're not covering resources through CDBG that were already paid for with another resource. Next slide, please. There are also a couple of key facts around federal mortgages and what's been done around forbearance and moratoria. On federally backed mortgages for individuals, there is a 60-day moratorium on foreclosure for all USDA, FHA, VA, Fannie Mae, and Freddie Mac loans. That started on March 18th. There's also an allowance for a forbearance for up to 180 days that can be requested by a borrower, and that can be extended for another 180 days if the borrower needs it. There are also several opportunities for multifamily properties. So housing owners of multifamily properties can request a 30-day forbearance on their loans that are federally backed on the condition that they do not evict tenants, do not charge any late fees. There is a moratorium of 120 days for filing evictions for residents of federally backed mortgage and multifamily properties. And there is a temporary moratorium on evictions for most residents that are in subsidized apartments of HUD, USDA, or other low-income housing tax credit finance properties. In addition to CDBG, there's a total of about $12 billion in CARES Act funding that is being administered by HUD. That includes about $4 billion for the Emergency Solutions Grant to address homelessness, as well as housing for opportunities for persons with AIDS, rental housing assistance through project-based rental assistance, the Public Housing Operating Fund, programs for Native Americans, as well as the Section 202 for the elderly and Section 811 for persons with disabilities. To touch on kind of a very quick overview of CDBG, CDBG funds are awarded by formula to about 1,200 localities each year. There's a lot of flexibility under which a grantee of CDBG can articulate in its action plan how it intends to spend its money. 70% of funds must be spent for persons of 80% AMI or below, moderate income or low income. And the flexibility from an activity perspective is very broad. If we could move to the next slide. In terms of the COVID response for CDBG, there's $5 billion that's been allocated under 3 tranches. The first $2 billion, the first tranche, it has been allocated already by formula based on the FY20 formula. So grantees know what they're receiving. Those allocations have been made. The next $1 billion, that second tranche, is going to go directly to states and to territories. HUD is going to make announcements about how that'll be allocated by May 11th. This can be used in both entitlement and non-entitlement areas, which is relatively new for states that receive CDBG. Normally, state CDBG only is spent in non-entitlement areas. And then there's a final $2 billion that's going to be allocated on a rolling basis under a formula that the Secretary is going to announce based on impact of coronavirus. There are a couple unique factors in this $5 billion as well. There's $10 million that's been allocated for HUD to assign via technical assistance partners. There are no caps on public services, which is also unique under this circumstance. HUD has authority to waive regulation and statute within this instance, which is also uncommon. HUD is allowing grantees to use CDBG for rental assistance without a waiver for up to 3 months, provided that it's paid to the landlord, not the tenant. And all that a jurisdiction needs to do in order to take advantage of that is to submit an amendment to their action plan. And I think it's still to be determined whether there may be allowance for rental assistance beyond 3 months without a waiver. Just to give some examples of what CDBG can be used for in this instance, it can be used to construct medical facilities, to expand hospitals through the acquisition of a hotel or motel. It can be used to replace HVAC systems or temporarily transform commercial or school buildings into medical facilities. It can be used to purchase manufacture medical supplies. It can be used to support group living facilities or for even job training for healthcare workers and technicians. So there's a lot of flexibility in how CDBG can be a resource, both for services in this instance in particular, and really helping jurisdictions think differently about what a response to COVID-19 looks like. So Marion, if I could hand it back to you.
Thanks, Patrick. Appreciate the overview. Next slide, please. We are honored to be joined today by John Gibbs. He is the Acting Assistant Secretary for Community Planning and Development at HUD. He has stepped into the role at a historic time for the department. He is responsible for managing tens of billions of dollars in annual formula and competitive grants, as well as disaster recovery dollars. And he is responsible for more than $9 billion in funds to respond to the coronavirus, as you just heard in Patrick's recap of the CARES Act. He's joined by his colleague, Jessie Hanforth-Combe. Jessie is the director of the Office of Block Grant Assistance. She has been working with the CDBG program for more decades than she'd probably want me to count. Jessie is a member of the Career Executive Service at HUD. There is no greater civil servant here in Washington, so we look forward to hearing some of her answers to the technical questions raised. Again, as a reminder, you can put questions into the chat box, and Acting Assistant Secretary Gibbs and Jessie will take those after his opening remarks. With that, sir, let me turn it over to you.
Thank you, Marion, for that introduction. I really appreciate it. And thank you for having me on the call today. As Marion said, I am John Gibbs, Acting Assistant Secretary here at Community Planning and Development in HUD, or CPD for short. And it's great to speak with you today. I began my career at HUD 3 years ago, not nearly as long as some of my great colleagues, but it has been quite a great experience thus far. So it is good to see that Marion and also Patrick are fellow CPD alumni. And so I'm in a friendly company here. Speaking of CPD, I would like to especially thank my colleague Jessie Hanforth-Combe, who's on this call with us today, and the rest of our really hardworking staff within CPD. Folks have been just absolutely tremendous in turning things around very quickly. This is a rather unprecedented situation for us. We have so many different requests coming in from every direction at the same time, And our team has just been doing a really great job of getting things out and really thoughtful about it. So I just want to thank Jesse, as well as everybody else on our team at CPD and HUD. We've been doing a tremendous job. And on behalf of President Trump and Secretary Carson, I want to thank all of you on this call for the work you're doing in your communities to help the most vulnerable. That is a really big crisis, really big priority for us. And responding to this crisis is empowering local communities and local stakeholders to really respond and meet the needs of our community. So we are glad to be able to do that, and we thank you for being there for your communities during this time. So I would like to talk to you here briefly about CDBG from the CARES Act, which we call CDBG CV for short. And so we are aware that this is just a very difficult time for people. So our goal is really to make sure that we get this funding out to you and make sure that it's really usable in a way that lets you meet the needs of your community. And so we're excited to be able to do that. As Patrick mentioned, there's also some technical assistance available as well. So that is a resource that will be able to help people as they are ramping up and using these funds. Now, the CARES Act was enacted on March 27th, and again, as we shared earlier, it provides $5 billion for CDBG. The first $2 billion of that has already been announced, and that uses the FY 2020 CDBG formula. The next tranche is $1 billion, and we've got to announce our allocation for that by May 11th. Congress did give us a flexibility to design a formula to decide how that money goes out, and we are being very thoughtful about making sure that it goes to the communities with the greatest needs. And beyond that, there is an additional $2 billion in CDBG that goes out on a rolling basis that doesn't necessarily have a deadline attached to it, but also is going to be going out based on needs. So we're going to be carefully looking at the data as it comes in day by day and making sure that we design a way for those funds to go out to the communities that really need them the most. So you might be aware of this already, but all CDBG CV activities must prepare, prevent, and respond to coronavirus. So that's the goal of the program, so that's what the funds are used for. We have published a 2-page guide on our website on HUD Exchange called Eligible Activities for Infectious Disease Response. And that gives you a really good sense of what activities are eligible to be responding to the crisis we're facing with your CDBG funds. And we do update our website quite regularly, and our folks have been doing a really good job of keeping up-to-date information on there and updating things on a regular basis. So do go ahead and check out HUD Exchange, as well as HUD.gov/coronavirus. We've got a lot of good information on there that's updated frequently, so you'll be able to keep up to date with what we're doing. We did also provide quite a broad range of flexibilities that give grantees the ability to do things that normally would not be possible with a regular CDBG appropriation. We'll get into those a little bit later, but we have information on that on our website as well, and I'll get into that here in a few minutes. But we are providing quite a range of waivers and alternative requirements, and we are listening to our stakeholders. Thank you for all of you for getting in touch with us. We do hear the feedback, and we want to make sure that the waivers we're offering are responsive to the needs of the community. One of the big issues that we are being very on top of right now is this issue of duplication of benefits. And we want to make sure that when the funds go out, they're being used to pay for things that another source of funding is not paying for, so that we get the most efficient use of the funds. Enterprises, as a TA provider, is helping us out with that. We're working on a tool that will assist communities in managing the issue of duplication of benefits, and so we're very glad to have you working with us on that at Enterprise. So I just want to go over a few of the program changes for CDBG from the CARES Act that are different than the typical CDBG appropriation. The first, as was mentioned previously, is a public services cap has been suspended for both the CDBG CV funds as well as for FY 19 and 20 as well. The plan deadlines are extended for fiscal years 19 and 20, and those are extended to August 16th, 2021. The citizen participation period has been expedited from 30 days down to at least 5 days. And finally, public hearings can be virtual. So those were some of the self-implementing program changes from the CARES Act that gave it additional flexibility beyond what the typical CDBG program offers. So as far as applying for your funds, the fastest route for most grantees will be to make a substantial amendment to your FY 2019 action plan. Some grantees have already done that, and those have already been submitted in IDIS, and others are in the process of doing that right now. And on our end, we are committed to expediting the amendment and plan review process, so we do want to get those turned around quickly. We are also expediting the grant agreement process for this appropriation for CDBG, so we want to make sure that process goes as quickly as possible. So that's it for me right now. Again, I want to thank Marion and Priscilla and Patrick and everyone at Enterprise for the work you do and for having me on the call today. And also thank our great colleagues at HUD, including my colleague Jesse, who will be answering some questions with us later on. So thank you very much for all the work you do. Appreciate it.
Thank you so much. We so appreciate you taking time out of your very busy schedule to answer these questions. And I think it's fair to say the chat box has been blown up with questions. So let's sort them into a few categories and start with questions about the use of CDBG and CDBG CV for rental housing. Could you talk to us a little bit about what can be done without a waiver to serve emergency rental housing needs?
Jesse, I'm going to kick that one over to you to get into the details a bit.
Yes, sir. Thank you. The entitlement CDBG regulations, the part for cities and counties, provide in a sort of interesting double negative in the regs. In this section on ineligible activities, it talks about income payments being ineligible. At the end of that little section, and if you're a total nerd like me, it's at 24 CFR 570.207. It says, but one-time emergency payments for subsistence such as rent, mortgage, and utilities for not longer than a 3-month period is eligible as a public service activity. So emergency payments is what CDBG calls rental assistance for 3 months. It has to be paid to the provider. So the landlord or the utility company, you can't give it directly to the household. But it's eligible on its face. Now we've gotten some questions also, Marion, that some states aren't allowing it. States read their eligibility directly off the law, and not all of them will follow the entitlement regs interpretation.
It's an important tenet of the CDBG program that states get maximum feasible deference to their interpretation of the rules. And so they can read a little bit differently into the rules and make their own decisions. They get to choose from a menu of eligible activities. So a state or locality could determine not to do things that are allowed by HUD.
Yes.
Jesse, could you talk a little bit more about the ways in which affordable housing organizations can receive CDBG funds if that's the will of state and local governments?
The state and local governments can designate nonprofits directly, or they can compete the funds in a variety of ways. And so it's really important to talk to the grantees if you want to receive funding, because HUD's authority is to provide the funds by formula to these governmental entities.
And so it's possible that they could make the determination to use funds for rental assistance for short-term as well as for physical rehabilitation of units, for example, upgrading HVAC systems or making other upgrades necessary for the health and safety of properties for rental or for nonprofit, or for homeownership housing. Is that correct?
Yes, all of that rehabilitation of the properties is eligible. You have to tie back to the pandemic preparation, prevention, or response. And we're reading that pretty broadly because it's really not known how much all of this is going to affect all the different parts. We just tell the grantee to be reasonable and explain how the connection is made.
Do you have best practices about serving housing or documents that people should look for on the website?
We're working on producing technical assistance products, but there is already a great deal of CDBG material available on the HUD Exchange. And also some of the NSP material, like the rehabilitation toolkit, things like that. would also be applicable. But we are going to go through and you know, based on, we're getting questions in strong groupings and start answering, you know, just providing as many tools as we can in those grouped areas. And emergency rental assistance is one of those areas. I would be remiss if I didn't point out that, of course, this is something Emergency Solutions Grant can also do. And population. So you need to be strategic, and that's part of the duplication of benefits discussion, right? Is if you're getting both sources of funding, then you need to really sit down and think about what's the best use of each source.
Communities that have administered CDBG grants after disasters are probably familiar with this concept of duplication of benefits. But for communities that have not received those grants, this tends to be one of the toughest administrative requirements, in that jurisdictions receiving CDBG have to ensure that they're not being used to pay for a cost that's already been covered by another source. So this is something that jurisdictions receiving the funds are going to have to closely heed to HUD's guidance.
But it does look like, Marion, that the available to piece, the order of assistance, isn't in play. We're trying to get that all written down. It's really critical to not pay for something that somebody else could pay for. And it's really smart to use your funds strategically for gaps. But where those gaps are, it looks to us like it's going to vary by community.
Great. And then one last housing question here. How can CDBG funds be used for down payment? And could you talk about the income caps on the people who receive it?
Well, in regular CDBG, an annual CDBG, for your 19 and 20 funds, for example, down payment assistance can only be provided to low and moderate income people. It's a condition of the eligibility of the activity. But providing down payment assistance for the pandemic, I think we have to have a talk about how is that related to prevention, preparation, and response. I'm not saying it's not, I'm just saying that's not one I've heard before.
And when you look at someone's income, are you looking at it today at the point when they may have lost a job, or last year's taxes?
The CDBG regulations look at your income at the time assistance is provided, and you have to have policies and procedures to reasonably project that forward, actually.
So this is an important note, that there may be people who communities were not thinking of as qualifying as low and moderate income before coronavirus, but who have suddenly had a drop in income. Important consideration for communities that are rolling out their programs. Assistant Secretary Gibbs, let me ask you a couple of questions about the formula. The first being, will HUD publish, or has HUD shared the formula for the first round of funds, which is the HUD fiscal year 2020 formula, as you said? And is there a way for communities to weigh in on the formulas you use for subsequent allocations?
Sure. So as far as the first round of funds, the $2 billion that have gone out already, those went out according to the same formula as FY 2020. And so that information is out there in terms of the formula for how the funds are allocated. So for that, that's pretty much business as usual. Now, as far as the next tranche of funding for the $1 billion and then the $2 billion following that, we are planning to make those formulas publicly available. And so we do want to publish those for people to be able to see them, and so they can know what exactly the allocation methodology is. Now, as far as giving feedback, we receive feedback all the time, actually, on folks' thoughts on how the formula should take into account different factors. So, yes, please do go ahead and get in touch with us. So we are receiving lots of feedback on that. So, yeah, I think that's it.
Let's talk a little bit about small business assistance. Could you tell us how CDBG can be provided to small?
Sure, I'll touch on that briefly, then kick it over to Jesse. I think this touches on the issue a little bit of duplication of benefits. We've been having a lot of good conversations on those. So we do want to be mindful that SBA has programs on this, and other parts of the multi-trillion-dollar CARES Act package do have lots of support for small business. but I'll let Jesse speak specifically to CDBG and small businesses.
Well, John's exactly right that duplication of benefits definitely exists in this area, or the potential for it. SBA is making small business loans and likely to get additional assistance. The EDA, also, we've been talking to them about some of their programs for small businesses, and there's some smaller things around. So we've been exploring, talking to the other agencies, looking for gaps, looking for things that our CDBG grantees are asking us they want to do, that, and saying, you know, checking with other agencies to see if it fits them or not. And we want to get out some quick program sheets to show where we see gaps. So I can tell you one that we can see right off the gate is that a lot of communities have been asking us about doing programs to upgrade neighborhood shopping areas. So for curbside pickup and for wider sidewalks, to enable social distancing, and to enable handless entry into local businesses, and possibly enable spaces for temperature checks and things like that, because the local neighborhood businesses can't pay for that. And from what I gather, nobody else can pay for that. That looks like that's one that some of our grantees are looking at and nobody else can do. A lot of those businesses are also micro enterprises. So we're hunting for those kind of gaps and spaces where the program is just by its nature not going to be a duplication of benefits. But there are also going to be cases where somebody gets an SBA loan and their credit will only take them so far and they need something else, and you're going to have to work together. Those are going to be trickier, and we're going to train our field offices to help work with you on those kind of cases. And then a lot of micro enterprise questions, especially about helping new businesses start to take advantage of like essential business niches and how they can get business plans and things like that. And so we think that's probably another space where the program team wants to provide some technical assistance.
Could you tell us a little bit more about your plans for technical assistance? The law says that you'll speed assistance to communities. What does that mean now that you have a new $10 million allocation?
John, you want that, or you want me to take it?
You can go ahead and take that one, Jesse.
Well, I'll tell you that we're heading to you with a technical assistance proposal either late this week or early next week. We've already set the wheels in motion so that the TA providers we're going to task know that they've been selected. But they don't know what for yet. So we're working on that, but we have picked a stable of TA providers, and we are working on a plan that's going to involve, what we're going to propose is less direct interactive TA with, going deep with every grantee, because there's 1,250 of them and only $10 million. I know it sounds like a lot, but it's not. And doing a lot of tools, on-call assistance, ask a question, try to get material that we push out to grantees. And at the same time, along with this, not using the TA resources, we are training our field staff on all the programs that are coming through CPD. So that they can also help provide assistance, particularly where the programs intersect.
Thank you. A few questions about infrastructure coming through. Will communities that are doing infrastructure now be permitted to reimburse for work they started as a result of COVID?
Jesse, you can also go ahead and take that one.
That's a very weedy question. Reimbursement, regardless of the date that the costs were incurred for preparation, response, or prevention of coronavirus, is allowed by the CARES Act. And that is an area where we're going to have to put out quite a lot of guidance because it intersects potentially with all the cross-cutting requirements like environment and Davis-Bacon and labor standards and a lot like that. Unfortunately, we do have experience in disaster recovery with this. So the answer is yes, but not if it was just an ongoing project that wasn't about the pandemic.
Okay, thank you. A few questions about meeting national objectives. So under the law, 70% of the funds have to be used to primarily benefit low and moderate income people and 30% of the funds can be used for other national objectives, so meeting another urgent need or addressing slum and blight in the community. Do you predict that you will issue waivers or otherwise modify the amount that can be used for purposes other than serving low and moderate income people?
And Jesse, that's another one I'll kick over to you.
Okay. There isn't any plan at this time to waive the 70% requirement for low and moderate income, because as John pointed out, there's trillions of dollars in play, and a very few of these dollars are coming through CPD and earmarked for vulnerable populations. So there are a lot of other resources here that can deal with other populations, the general population, but not very many that are earmarked for low and moderate income. So the 70% will hold. In terms of documentation for urgent need, national objective, we've been asked that a lot, and for the first time in the program, actually, for the regular CDBG program. And we are looking at ways that we can make the documentation burden much lighter for that. It's fairly obvious if you're under a public health decree or a pandemic that you have an urgent need.
Some questions about the use of funds. Can they be used to pay for first responders and essential staff of the jurisdiction? And can they be used for permanent assisted living facilities?
And that's another Jesse one.
The first responders answer is tricky. The answer is it's possible, but we don't pay for general conduct of government, so their base salary, maybe not. If they were, I mean, it's not related to the pandemic. If they're doing extra work and increased level of work, then that could be a public service in the CDBG sense. But in a lot of places, because of the disaster declarations, FEMA is paying for a lot of those costs. So you have to navigate duplication of benefits, unfortunately. And in the communities that got the Treasury funds, that is a cost that can be paid with the Treasury funds, and they have almost no strings. So this is one where you need to be strategic about where you put your money down. On permanent assisted housing, is that what the question was, Marion?
Mm-hmm.
There are ways to do that. You definitely have to establish the pandemic link, the response, preparation and prevention. But you know, if you are trying to prepare for and prevent a second wave and you want to get people that are not in permanent housing into permanent housing, we can definitely work with you there with CDBG CV if you need to do that. I mean, there are definitely vulnerable populations that need, you know, the health and housing link is definitely there for that, for the kind of housing. But CDBG doesn't do new construction of housing. We do tend to view permanent assisted housing as a public facility instead. So that's when you want to talk to your field office. You want to get to your grantee and go talk to your field office about it. I know that's a lot of answer, but it's a trickier area.
It's a lot of program and a lot of rules, so that makes sense that there's a lot of answer. One for you, Assistant Secretary Gibbs. I think I won't phrase it as a question, but say this is something we're hearing from panelists and from communities, so that we would ask that you take back to the Secretary. Is there going to be some advocacy to the Hill to provide better protection than the foreclosure moratoria? So the way it works right now, it seems that there is some period of time when mortgage payments aren't due, but when that period is up, a balloon payment will have to be made. Otherwise, properties will go into foreclosure. So something that we're hearing from the panelists and around the country is a need to tack those months on to the end of the mortgage period rather than have a balloon payment due.
Yeah, thank you for that question. We are getting that feedback quite a bit. That is a little bit outside of my bailiwick. Our FHA folks and our Ginnie Mae folks as well are actually spending a lot of time looking at that issue right now and working closely with FHFA as well. So I know that people are thinking about that and developing a response to that. But I myself am not too heavily involved in that here in the CPD realm. But I would say stay tuned and keep in touch with us to see what our friends at FHA come out with on that.
Thank you so much. Also, there are multiple questions popping up about what communities have to do to reallocate their existing money under their fiscal year 19 or fiscal year 20 CDBGs, or to program their new money. Could you talk a little bit about the citizen participation process as it exists now?
And I'll kick that over to Jesse.
Thank you. The easiest way to think about it is citizen participation is the same, just expedited. So when a grantee wants to amend its action plan, which is how we call it, it's like its budget, it needs to do an amendment. If it's creating a new activity or deleting an activity or changing beneficiaries, it's called a substantial amendment. And so these are all going to be substantial amendments. And they're the same for FY19 or 20 or the CDBG CV money. You do a substantial amendment, you put in it whatever programs you're amending, could include also ESG, and you say what activities you're going to fund, which ones you're not going to fund if you're unfunding something, you know, moving funds around, and you put it out there, and instead of for 30 days, you're putting it out there for 5. At the same time, you are putting out your citizen participation plan and amending it to say, not for 30 days, for 5. If you decide that you're going to be doing virtual public hearings, you'll also amend your citizen participation plan to say that we'll be doing virtual public hearings for any required public hearings. You don't have to submit the CP plan to HUD. You just respond to citizen comments and submit the amendment in IDIS. You have to also submit these forms called an SF-424 and an SF-424D, and your signed certifications, which are the same as your regular CDBG certifications. And then it gets inside HUD, and HUD starts reviewing it as fast as we can, because we've been told to do that, and because we want to. And then HUD will put a grant agreement back out. The law does say at least 5 days. We have seen a couple of grantees taking a little bit longer, that they want to get more citizen comment. It's up to the grantee. Marion, I think you're on mute.
Thank you. Could you please tell us a little bit more about the way that funds can flow to a nonprofit? So jurisdictions now have an unlimited ability to pass through funds for public services. How does that actually work?
And I'll kick that to Jesse as well.
That's gonna vary by jurisdiction. They get to decide whether they're going to carry out activities with their own staff, with contractors, with subrecipients, with developers. If they decide to go with subrecipients, which is what we call it when they give it to a nonprofit most of the time, they can just select them without any competition, or they can compete it. I think a lot of them are moving in the just select direction right now, particularly with subrecipients they already have an arrangement with. They will have to execute an agreement with a scope of work and a schedule, and saying the amount of money and all the usual like environmental and labor standards and Section 3 and all of that, the boilerplate of the program, and convey any of the streamlining things that they're passing through. And that applies whether it's an urban county going to its sub-local governments, or one of our entitlement grantees going to a subrecipient nonprofit.
Could you please explain non-entitlement versus entitlement communities, and when states will be permitted to use their funds in entitlement jurisdictions as well as non-entitlement?
I'll again kick that to Jesse with the interesting caveat, and I think that was mentioned earlier, that the $1 billion chunk that's coming next can be used for, is going to be for entitlement and non-entitlement. But I'll kick it to Jesse for more detail there.
No, that's absolutely right. States, the $1 billion the next round, the CARES Act says states can act throughout the state in entitlements or non-entitlements, and they can act directly. In the first round, it's still an open question. They didn't do it in the CARES Act, but they did give HUD waiver authority. We're not entirely clear yet why Congress did that. And so that's one area where we have to consider, but states have been talking to us about their needs, and we're compiling that all and going to be bringing that to leadership as part of the clearance process. Most states want to give money to non-entitlements non-entitlement is HUD's term for grantees for local governments. We call them UGLUGs, units of general local government, who are not getting funds directly from HUD. They're not part of the 1,250 whatever CDBG formula grantees. And there's about maybe 5,000 or 6,000 a year, maybe, give or take, that get funds that way from states. So the states are pass-throughs for the first round of funding, just as they are for regular CDBG at this point.
Thank you. Assistant Secretary Gibbs, you mentioned that folks should reach out with their community's needs. What is the method they should use for doing that? Should they go through their local field office or contact headquarters?
Jesse, I believe we have an email inbox. Is it cpdquestionsanswered@hud.gov? Am I getting that right?
Yep, you did.
Yeah, so folks can use that address, cpdquestionsanswered@hud.gov, to get in touch with us on any feedback or questions.
And after the webinar, we will take all of these questions and drop them into that mailbox. So folks who haven't gotten their questions answered today, rest assured we will submit them to HUD. Could you let us know what you're going to do in terms of answering those questions?
We do have a workflow in place to address those questions, so I know that they are being answered. As far as timeframes, I'm not sure what the backlog is or anything like that, but we do want to answer those. Jesse, I'm not sure if you had any more color on that one.
Other than that, there is a substantial backlog right now because a lot of the questions are, will you do this in the notice or will you do that in the notice? And obviously we're not quite at the notice yet. We're answering all the ones we can answer. And then if you submitted a question where the answer might be, it depends, but we would know in a week or two when we have the notice, we're holding it. And they're coming in big groupings. There are definite patterns we can see, and we're very interested in the feedback from this webinar to improve our understanding of what CDBG CV's role is going to be.
Well, thank you both so much. Before we let you go, is there anything you can share about what the administration may be asking for in the next package? For example, will we see more homeless funding? Will we see more CDBG or home funds being requested?
I'll go ahead and take a stab at that first. So the Congress was scheduled to be back in session starting next Monday, May 4th, but that is not going to happen now. I believe the House has announced that they are not going to be back in session on that day. And so we're not going to have the whole Congress seated for at least, it looks like, a week and a half now. So it seems like the urgency level for a phase 4 package may have died down a bit. So I think that from my understanding of things are still in a little bit of flux. That being said, there are lots of proposals floating around, some with quite extraordinary numbers of funding attached to them from the Hill. So I have seen those floating by. Who knows what will actually be considered and that will actually go to the floor and be voted on. But yeah, there's lots of stuff that is being considered right now, both in terms of homelessness, as you mentioned, in terms of emergency rental assistance. So the sky's the limit in terms of what people are proposing. But we don't really have a clear picture right now as to what is going to actually make it into something that might get enacted.
Okay, well, on behalf of all of us, thank you again so much for making the time to talk with us today. Appreciate it. Next slide, please.
Thank you so much for having us.
Okay, before we close, wanted to take a minute to talk about what Enterprise is seeing as a need for future recovery package and encourage you all to become advocates for additional assistance, because we know that the amount of funding that's been provided is nowhere near sufficient to meet the needs you're facing in your communities. So we've divided our asks into two categories: appropriation and tax. So hearing a huge cry across the country for rental assistance, even with the enhanced CARES Act unemployment insurance that families have available through July 30th, a real concern about people being able to meet the increased costs of staying home now that their utility bills are going up, as well as medical costs going up, groceries being more expensive, and other daily expenses. So we want to ensure that there is funding for rental assistance, as well as for the home program, which has not gotten funding under the CARES Act to date. That would be important for building owners who are also facing increased expenses, the cost of keeping their buildings clean and secure, having staff on site 24/7, and also paying their share of increased utilities, for example. We'd like to see additional funding for the CDBG program. The $5 billion that was provided is terrific. However, it was an anomaly of the process that it was funded at $5 billion, whereas the Senate had $10 billion in their bill and the House had $15 billion. It doesn't usually go down from the lower number. Well, that was, as we understand it, because of the funding that was provided for flexible block grants through Treasury. However, that Treasury funding doesn't come with a requirement of primarily benefiting the people in the communities who need it most. So it's important that there be more flexible dollars provided to communities through the CDBG program. We're also asking for no less than a year's additional funding for the Section 4 capacity building program to provide direct support and technical assistance for CDCs nationwide who need to retool to address the changing economy and pay their basic operating costs with decreased revenue. Also, inexplicably, rural housing was left out of the CARES Act package, so asking for funding to shore up the rural housing service funding, housing programs, as well as $1 billion for the CDFI fund. Next slide, please. Also, I won't go too deep into the low-income housing tax credit because I know it can be difficult to follow how syndication works, but just a couple of points I'd like to make. We would like to see immediate relief by Congress enacting a minimum 4% housing credit for units that were placed in service beginning January 30th of this year, and allow developments to access 4% housing credits by lowering the 50% test. So the 4% credit is important in this context because it's actually tied to federal borrowing rates, which are now going to be 3.08% in May. So the credit is not going to be as powerful as it was at a time when developments are seeing increased costs due to broken supply chains, due to delays in construction from some jurisdictions, putting new safety requirements in place for workers or banning construction altogether. It's important that we ensure that we have funds available to meet the gap on these projects, which originally expected that they would have less need than they do now. The low-income housing tax credit is responsible for the lion's share of new affordable housing that's built and preserved in the country. So it's important that we take care of the low-income housing tax credit and make sure that it can work now and as a part of a long-term recovery package as we see Congress come back to town and take a look at the economic needs for the country. Our website for low-income housing tax credit advocacy is www.rentalhousingaction.org, and I encourage you to take a look and heed our calls to advocacy there. Next slide, please. You see on your screen emails for Patrick, Jordan, and myself. Like I said, we'll take all of these questions and put them into HUD's CPD questions answered mailbox, and you can check the website there for official answers to your questions. But in sending out a copy of this webinar and the deck that we use today, we'll do our best to record some of the major themes that were included today and provide what guidance we can. With that, thank you again so much for joining us, and we'll sign off.